When you get diagnosed with cancer, everything's out of your control. That first round, especially not being anywhere near home, not being anywhere near your comforts, it just overwhelms you. As soon as the option came to come closer to home, put my hand up straight away. I'm like, yeah, whatever I need to do, get me there.
Cancer doesn't discriminate, and it can affect people across regional South Australia as much as it can within the city.
I was diagnosed with bowel cancer in April. I had an operation straight away, started chemo 7 weeks later and had to have 12 rounds of chemotherapy.
We have patients now who hear about us, who will come in and ask, I've been diagnosed with cancer, can I have my treatment here? In the years gone by, quite often we'll say, unfortunately at this stage, no, you can't. We now can say yes to quite a few more patients, and they're ecstatic that they don't have to travel.
The country cancer chemotherapy services are being expanded by employing additional staff. This will increase the number of country patients having their chemotherapy closer to home. Chemotherapy units are classified as low, medium, or high complexity. In country, we have 12 low complexity units and 3 medium complexity units. The aim is to increase the medium complexity units from 3 to 6.
I have had patients who have declined treatment because they've had to go to town. They've then asked their treating oncologist, what else is available? Is there something I can have here? And it may not be something as complex, it might be a low complexity treatment instead. But if that's what they need to do to stay locally, that's what some people do choose. So it can affect their wellbeing, their life expectancy as well.
Here at Flinders, we're proud to be working with Country Health. The initial chemotherapy treatments that we could give at the South Coast District Hospital had to be low complexity, and that limited the number of chemotherapy treatments that we could administer. So we had many patients who unfortunately could not receive their chemotherapy close to home. By working together and supporting the team at the South Coast District Hospital, we can now administer medium risk chemotherapy treatment safely and effectively. And this means that we can treat so many more patients close to home.
Having that little bit of control back in the home and making sure that my son could still keep his routine helped the whole household, and that kept him happy, which kept me less stressed. We wouldn't have been able to do that if we'd had to go to Flinders.
Sharing a patient's journey is honestly a privilege. It's such a traumatic time for people. We're that familiar face, and I always say guiding light as well for patients.
They make you feel like you're the only one, even if all the chairs are full. You're the only one that they're actually helping at that moment, even though they're helping everyone in the room. Almost like they're counsellors as well as nurses.
We've seen the benefit. We see it when we see our patients. Get up in the morning, have breakfast, go and have their treatment. They're back home in time for lunch. They live a normal life by having their treatment closer to home.
The expansion of Country Cancer Services will allow us to double the number of sites where medium complexity chemotherapy can be delivered. We're developing that at Riverland General Hospital in Berry, in South Coast, and also over in Port Lincoln.